And Victoria, thank you for sharing your experience with panic and anxiety. A lot of people are experiencing panic and anxiety right now. Okay. And I want you guys to know that this is normal that you're feeling anxious. We're all stressed. We're all anxious. So there's nothing wrong with you that you feel that way. But the first line of technique I would always teach is take some deep breaths. This takes less than a minute and it'll reset your entire biological system because it doesn't require you to, in your mind, say calm down. When you take deep breaths, it resets your biology. It tells your body automatically things are okay. We're not in any danger here. There's no reason to get into a fight or flight mode. So it actually is an automatic process. Even if your brain is interfering and thinking a bunch of thoughts, just take a few deep breaths and repeat this mantra to yourself. I've done everything I can. Okay. There's a lot of things that we cannot control right now. And you gotta let those things go. Make a list of the things that you can control and take an actionable step for every single one of those items so that you can protect yourself more, take care of yourself more. Then make a list of things that you can't control, like how long this pandemic is going to go on for. We don't know. Take a look at that list, breathe and let it go because we can't control it and you're going to drive yourself crazy if you try to control everything. Okay? So summary, take a few deep breaths, write a list of things I can control versus can't. Take an actionable step for everything you can control. And for those that you can't, take a breath and let it go. We have some other questions here about sleeping. So Elizabeth says, I can't sleep at night because I'm worried about losing my job. What are some ways to calm myself down and finally fall asleep? And should I take melatonin? So this is a really good question, Elizabeth. I think a lot of people's brains are just going overtime right now, and it's hard to fall asleep. And also sometimes your schedule is totally all over the place. And then it makes it difficult to go to sleep because you've been maybe napping or you've been waking up at random hours, and then it disturbs your sleep at night. And so the most important thing to improve your sleep is certainly to keep to a schedule. So still wake up around the same time, set an alarm if you have to, go to bed around the same time. And one thing that really helps to set your circadian rhythms is to get a little bit of sunlight in the morning hours. I recommend about 20 minutes. If you have very, very fair skin, then maybe 10 minutes. And you can also get indirect sunlight, like sitting near a windowsill and having the window open. But this is extremely important for resetting your circadian rhythms and helping to improve sleep. So again, about 20 minutes or so in the morning on average is really helpful for that. For a lot of people, napping for long hours in the middle of the day is going to disturb your sleep. So make sure that if you're napping, that it's under 30 minutes. Power naps are great. I love power naps. I'll take a 5-minute power nap anytime, but we need to make sure that it doesn't extend beyond 30 minutes because then you start to get into some of the longer sleep cycles and then it messes with your sleep cycles at night. Then it's really important that you have a sleepy time routine. And so having good sleep hygiene is very, very important. So one good tip is to start powering down your devices about an hour before you go to sleep. But even in the evening hours, some people like to wear blue blocking glasses. I think that's good, to block out some of the blue, the harsher rays from your devices that tend to make people feel more alert. There's settings on your laptop and phones where you can do the night shift. And that's what I have on my phones and my computer. So after 7 p.m., everything just starts to dim down. It has a more warm tone. So that's really helpful. But then an hour before you think you want to go to sleep, just power down all your devices and take your time to have a really nice sleep routine. So take your time getting into your pajamas, take your time brushing your teeth and doing everything that you have to do at night. And light some candles, play some soft music, really appeal to the sensory aspects of yourself to try to calm yourself down and to start unwinding. And then I would do an exercise, again, device-free, that is generally relaxing, like reading or doing a jigsaw puzzle or knitting or just, having nice conversation with your family. And don't actually get into bed until you're an 8 out of 10 on the tiredness scale. The reason for this is sometimes people get into bed too early and they're not tired, and then they lay in bed thinking and they're all anxious about everything. And then now the bed becomes associated with anxiety. So we don't want the bed to be associated with anxiety. We want the bed to be comfortable, to be relaxing, and you should only really use your bed for sleep and sex. Okay. So don't be bringing food in there. Don't be bringing work in there. That's also a big part of having a good sleep routine. Melatonin works for some people and not for others. Again, talk to your doctor. Generally, it's safe for many people, but some people either have no effect to it or they don't like it. And so you can try that out, but I would definitely suggest those behavioral strategies first to see if you can get a shift in your sleep cycle. Amy, is it possible for people to recover without receiving treatment? Absolutely, Amy. As I mentioned, the majority of people are going to have mild symptoms and will recover from home. The statistics is about 80%. So if you contract COVID, don't feel like it's the end of the world, because 80% of you will likely just have mild symptoms and recover at home. What's scary about COVID is that it seems more contagious than the common flu. So the common flu, the level of contagiousness is 1-to-1 pretty much. So if you are somebody who has the flu, you might give it to one other person. What we're finding from research with COVID is that one person who is infected can give it to 2.5 to 3 people. So it's about 2.5 to 3 times as contagious as the common flu, and we know less about it. So that's why it's so scary. And so I think that that's all of the unknowns that are kind of stressing people out. But just know that for 80% of people, they're just going to recover from home. And some people won't even get tested. They'll just say, well, maybe I have COVID. They'll talk to their doctor. Their doctor say, well, yeah, maybe you do, but your symptoms are so mild. Just hang out at home. Let me know if anything changes, but otherwise you'll probably feel better in a week or two. And so don't worry so much about, if this is always going to lead to a severe scenario. It might not. And actually, most likely it won't for 80% of individuals.